Good morning, everyone. Today I thought that I will teach you about the cardiovascular diseases in the NCLEX. Before beginning all these things, I just want to say NCLEX is not about mugging everything. You should know the basic things. It's a refreshment to our journey throughout the nursing. So you have already studied all these things, but just as a refreshment to your basic things to make sure that you know everything. So before beginning to the cardiovascular disease, this cardiovascular concepts you should know, the anatomy, physiology, risk factors, causes, medications, what are involved in the cardiovascular system. So beginning with the anatomy and physiology of the heart, as we all know that our heart has four chambers, right atrium, right ventricular, left atrium and left ventricle. Walls are tricuspid, pulmonary, mitral, which is also known as bicuspid, and aortic walls. The conduction system, it starts from the SA node, which is our pacemaker of the heart, then goes to AV node, bundle of hairs, right and left bundle branches, and then Purkinje fibers. The cardiac cycle has two phases, systole and diastolic phases. Now coming to the electrocardiogram. So, as we all know that when our cardiovascular system is affected, our basic thing is we go to the interpretation of the ECG. So, understand the ECG is very important. You should understand the PQRST wave. Where is its origin? What does it indicate? Like P wave, it's going to it will indicate the arterial depolarization. QRS complex ventricular depolarization. T wave is the ventricular repolarization. Normal sinus rhythm, regular rhythm. The heart rate is normally 60 to 100 beats per minute. Abnormal rhythms are atrial fibrillation, ventricular fibrillation, premature ventricular contractions, bradycardia, tachycardia, and heart blocks. Now, coming to the common cardiovascular conditions, hypertension, the causes, risk factor management, medication, lifestyle changes. This all will be discussed later on. Coronary artery diseases, atherosclerosis, angina, myocardial infarction, and the role of medications like nitrates, beta blockers, and anticoagulants. Heart failure, two types are there, left-sided and right-sided. The symptoms will be dyspnea, fatigue, edema, and management strategies are diuretics, AC inhibitors, ARBs, and beta blockers and inotropes. Arrhythmias, identifying and management abnormal rhythms such as atrial fibrillation, ventricular tachycardia, and atrial flutter. Cardiomyopathy, types are directed hypertrophic, then restrictive, and its interventions. Valvular heart diseases are mitral regurgitation and aortic stenosis. Now coming to the pharmacology related to cardiovascular care, antihypertensive, AC inhibitors, ARBs, calcium channel blockers, diuretics, beta blockers, anticoagulants and antiplatelets, which are warfarin, heparin, enoxaparin, aspirin, and clopidogrel. Coming to the statins, that is commonly used are atorvastatin and simvastatin, that is to control the cholesterol management. Antiarrhythmic drugs are amiodarone, lidocaine, and procainamide. The diagnostic procedures that are performed are cardiac biomarkers, troponin and CKMB, and pro-BNP are done. Echocardiography to assess the heart functional structure. Cardiac catheterization and angiography, it is done to know the diagnostic procedures to visualize the coronary artery blockages. Then stress testing, evaluate the heart function under exertion. Now coming to the management and interventions, cardiac monitoring, continuous ECG monitoring for the patient has to be done who have arrhythmias or undergone the cardiac surgeries. Then defibrillation and cardiovation for life-threatening arrhythmias, example ventricular defibrillation and ventricular fibrillation. Then surgical interventions like coronary artery bypass grafting, CABG valve replacement, pacemaker insertion, etc.